They are defined by two imaginary vertical lines and two imaginary horizontal lines. I start with the horizontal lines. The upper one runs through the subcostal plane. It's called the subcostal line. You feel the lowermost border of the subcostal margin. There you have the tip of the ninth rib. That is where you trace that line. Some people say transpyloric. Some examiners don't accept. Why? Because you can't see somebody's pylorus, but you can feel somebody's ninth rib. So you can use that as an anatomic line to take the subcostal line. The lower horizontal line, you feel for the iliac crest on the both sides, and then you take a line along the iliac crest. Is it clear? The vertical, so that line is called transiliac line. The vertical lines, you feel the borders of the clavicle, you locate the mid portion, you take a line from the mid clavicular line, you take it down to the mid inguinal line on both sides. On the left, the same thing, mid clavicular to mid inguinal. So when you draw those imaginary lines, it will define 9 regions, namely right hypochondriac, right lumbar, right iliac fossa, hypogastric or suprapubic, umbilical, epigastric, left hypochondriac, left lumbar, and left iliac fossa. So when you are palpating, you are supposed to touch those 9 regions. Examiner is looking at you. The way the marking scheme is done in the OSCE, it's not whether you do something, you just get the mark. It is graded. If you do the proper thing, you get the full mark. If you do what is partially correct, you get a partial mark. Are you following? If you did not do at all, you get 0. There are some things you will do, you get a negative mark. Don't tell me it is better not to do at all. It is better you practice and you do the proper thing and get your marks. Shall we move on? So we now go to palpation. Like I said, it starts with what? Light palpation. You first ask the patient, sir, is there any place you feel pain? Please show me with one finger. Okay, he feels pain here. So you come, you start your palpation far away from there. Light palpation, you just touch the abdomen and look at the face of the patient to see whether there is any sign of pain. When you want to palpate, your whole hand will be flat on the anterior abdominal wall. You can adjust it anyhow, but you use the palmar surface of your fingers to palpate. Is that clear? The palmar surface of your fingers. Your other hand should not be by your side, should not be in your pocket, should not be in your back. You place it on the bed or on the patient or on your palpating hand. I like to place mine on the bed. So if I want to palpate, since the patient has pain here, I will start from the right hypochondriac region. Do you see my palms are flat on the abdomen? I am not poking. My hands are not entering at an angle. Do you appreciate? It's flat. I make it flat. So I'm in the right hypochondriac region. While there, I look at the face of the patient. Light palpation means you just touch. That is all. You don't do this in light palpation. You just touch. You come to the lumbar region, you touch. While looking at the patient, you touch in the iliac fossa, you touch in the epigastrum, you touch in the umbilical. You touch in the right hypochondriac. I can come here now, is it not so? To touch in the suprapubic, and then I touch in the lumbar here, and lastly I will touch the left iliac fossa. So what I want you to notice that light palpation, you are just what? Touching. You touch. Palpation, you go to deep palpation. Deep palpation is meant to assess for masses. If a patient has tenderness, you will still give attention to it. So when you want to start your deep palpation, you start what? Far away from where the patient has tenderness. And when you are doing it, you will now be more careful because you know the patient has what? Tenderness. So how do we do deep palpation? The same way you come, your hands flat. The difference now is that you apply some pressure so that your hands are digging into the abdominal cavity. Then you begin to make circular motions, trying to feel for masses. Is it clear? That's what you do in all the 9 regions. You do that in all the 9 regions. Then when you get to where there is tenderness, you be very careful. Is it clear? So once more I differentiate. Light palpation, you just touch. You just touch. Deep palpation, you apply pressure and you make circular motions. You apply pressure and you make what? Circular motions to feel for masses. If you locate a mass,